Okay, can you see the presentation now?
Yes, we can see perfect.
Okay, so I am a speaker at TP Orthodontics in this very specific area, the use of the Pre-Finisher, that it's a fantastic device in finishing the orthodontic cases. So I need to start to telling you what is the Pre-Finisher, what are its functions and characteristics. I will tell you a little bit about the history of the Pre-Finisher, and I will show you 3 cases. These cases are completely different, and I gave them some titles. The first one is, how did Pre-Finisher turn a disastrous case into a success? The second, orthodontic treatment of simple cases with only the Pre-Finisher. The third one, anticipate the removal of fixed orthodontic appliances. I will talk about the benefits and limitations of the Pre-Finisher, how to choose the correct size, and give some suggestions for the use. So let's start. What is the Pre-Finisher? The Pre-Finisher is a functional, flexible silicone device which has the marks of the occlusal surfaces to fit the upper and the lower teeth. It has smooth edges so as not to hurt the patient, and has holes for the entrance of air for the patient comfort. Is just that image is very representative of the Pre-Finisher. It's the device, it's just like that. And here you can see it can also have some springs to close the spaces between the first and the second molar due to the bands, and it has a very important characteristic that it covers the second molar. Okay, as we know that the second molar sometimes are not fully erupted, and sometimes it's difficult to bond the band or the tube. So when we finish our treatment, if the second molar it not has a very good occlusal relationship, the Pre-Finisher would help on it. And its functions, the Pre-Finisher, TP tells us that Pre-Finisher corrects and matches teeth in both arches simultaneously, improving intercuspidation. It can do dental alignment, tooth rotation, closing diastemas, and it can be used to obtain a perfect finish of cases after remove the fixed or the removal appliance. And I will tell you a little bit of history just for you to understand how the Pre-Finisher began. So it all started in 1945 when Dr. Harold Kesling devised the customized silicone device for dental correction. Then Dr. Peter Kesling at 1978, in partnership with TP Orthodontics, developed the Pre-Finisher, and now in 2020 we have a new image of the device with this beautiful blue box. I will tell you a little bit in detail what happened. In 1945, Dr. Harold Kesling gave a name to his device, that is tooth positioning appliance, and the initial idea was to create a functional appliance that takes the teeth to their positions within the arch, between arches, and harmoniously with the face. We needed to do the patient molds, and from which a setup was mounted, and the device was performed on that setup. But it was noticed that it had better results as a retainer or an aesthetic finishing device than as a treatment device. So in 1978, his son, Peter Kesling, in partnership with TP Orthodontics, developed the Pre-Finisher as an aesthetic and functional retainer and finishing device. It can be widely used when, for whatever reason, it is necessary to remove the appliances before the treatment is finished. and it does not require the execution of molds as it is a prefabricated device. So exists in different sizes. So we must choose the size, the correct size for our patient. In 2020, there is a new TP creates a device that is adapted to the type of teeth of Asian patients, because as you know, the proportions are different from the Caucasian teeth. So what are the benefits of the Pre-Finisher that TP tells us that exist? So the Pre-Finisher can be an efficient and simple solution to finalize cases, either with fixed devices or with aligners. We don't have laboratory fees or waitings. You can deliver immediately the device to the patient when you remove the braces, and you can see the results in 2 or 3 weeks. But can we use Pre-Finisher in all cases? No. There are some limitations, and I will tell you right now about the limitations because it's very important to know. In almost cases, we can use it, but there are some specific treatment plans where we cannot use it because will have a good result. So when we need to extract just one lower incisor, when we do asymmetric extractions, if we need to do the extractions of the lower premolars only, when there is differences in tooth size between sides, and in patients with the Bolton discrepancy. Okay, in that cases, don't use Pre-Finisher after we finish the treatment. And I have also a special careful on the oral braces, because this is a device that you put in mouth and you should keep it with your mouth closed. And we know the oral braces during the sleep, they almost open the mouth and they can't have the device doing his job during the night. So in oral braces, I recommend the Pre-Finisher, but only during the day, some hours during the day, with some exercises that I will explain. So now I will start to show you the cases. And this is the case that led me to worship and gain blind confidence in the Pre-Finisher, and I think you'll understand why. Okay, this is João, it's a patient of mine. He was not in the mood to get a fixed device, and he don't want to collaborate despite the parental insistence, but he needed to correct several aspects, as it is a class 2 division 2. He has all the characteristics very evident, a cuspid and molar class 2, the superior lateral incisors with a labial inclination, the superior central incisors with a retro inclination, a deep overbite. But it was very difficult to him to wear rubber bands, to wear the intermaxillary elastics. So initially he used them, and a while later he stopped using them. Finally confessed that he would only wear them at night, never during the day, due to bullying at school. So the parents talked to me. I was unable to surpass this situation. After 2 years of treatment, he has a poor oral hygiene. It doesn't collaborate. And this was the scenario. So some aspects improved, but very far from being finished. The patient started to be anxious, and I was desperate. I talked to his parents and they asked me to remove the device because the João was feeling psychological, very ill. I talked to him and I realized that because of the anxiety was having a fixed device that he could never remove. I explained that the treatment was not finished, and after the parents signed the term of responsibility, I removed the fixed device from the patient. And when I removed the fixed device, this was the situation. And I was bothered. I just wanted to ask for help. I even said that if he went to another dentist, they would insist on him having orthodontic treatment because he really needed it. The case was not over. He had the tooth, the first upper right molar crossed, a cuspid class 2 on the left side, a diastema between the 12 and the 13 that I closed with composite because I couldn't bear to see that space in the front teeth. A palatal inclination of the central incisors, and the icing on the top of the cake, it was this open bite, anterior open bite, and the absence of the cuspid and incisive guide. And regarding the profile, this was the profile when I removed the fixed device. So what to do now in this situation? I was so frustrated, and how to transform, or at least how to minimize this failure. We often think that the path to success is straight and linear, but this is not always the case. Sometimes we have to be creative and think of alternative solution. In this case, what to do as the treatment plan that was outlined has failed. Well, the only thing that occurred to me, it was to use the Pre-Finisher, because at the time I didn't have lots of experiences with the Pre-Finisher, but I knew the device, and I knew that TP told us that Pre-Finisher has some characteristics that were very good to use in this case. It could help close the posterior open bite. It could close the interproximal spaces. If we don't have a space, if all the spaces were not over 1 millimeter in each arch, it can align the front seat if there is space, of course, when it's used correctly. TP tells me that it can correct anterior and posterior cross bites, rotates the central and lateral incisor as long as the space is available, maintain or correct anterior-posterior relationship, and level the Spitz curve to help correct deep anterior bites, as long as the patient uses it correctly. Well, I thought, honestly, I don't know if this is possible, but it's my only chance to try to minimize the failure. So I gave my patient the Pre-Finisher. I explained him how to use it, and he left the clinic with the promise to wear the Pre-Finisher on a daily basis, always over the night, and during the day, the many hours he could. So honestly, I didn't have much hope that the result would be minimally decent. But I gave him, when he left the clinic, he left like this, and I asked him to do some appointment for 1 month, but he didn't appear. The next 6 months, he didn't appear. And really, he was that kind of patient that we secretly wish would not come back, but after 1 year, he made an appointment and showed up. And when I saw that he had an appointment, I thought, well, I'm sorry. I don't know what is the situation when he came to the clinic. He left like this, so what to expect? And I couldn't believe it. After 1 year wearing the Pre-Finisher, the patient teeth and occlusion were doing very well. Okay, just the patient and the device. Okay, I didn't do anything for this. So notice the intercuspidation and the intermaxillary relationship. Sorry, do you want to do some question? Okay, this was the situation after the Pre-Finisher, before the Pre-Finisher. Okay. If you remember, we had the 16 crossed, a cuspid class 2 on the left side, a palatal inclination of the central incisors, the open bite, the anterior open bite, and now all these problems were solved. Okay, and we had a great result. So all the problems include the anterior open bite were solved. So regarding to the profile, notice how we can change and recover the original patient profile. When the device was removed, the fixed device, the incisors, the superior central incisors were retracted, and the nasolabial angle, it was open. And now with the use of the Pre-Finisher, not only the teeth are in the correct position, but the profile has recovered the support of the superior lip is more supported now by the teeth. And here we have before Pre-Finisher and after Pre-Finisher. And what about relapse when you use the Pre-Finisher? As for stability of the case, here are the photos of 2010 and 2018, in which the patient no longer wore either a Pre-Finisher or any other type of retainer. Okay, so this is after 8 years. Of course, after that, I realized the real scope of the Pre-Finisher and started using it in all cases after removing the brackets, the braces, because I knew that any little detail that needed to be corrected would be. So thank you, Pre-Finisher, for this. Thank you, TP Orthodontics. And I am an unconditional fan of the device. And you can understand why. So I will now show you some cases, not as dramatic as this one, but they are completely different. The next one is a very simple orthodontic case that the circumstances led to be treated with the Pre-Finisher. This is a young girl. She had already this beautiful smile and had this problem. And when we look at the problem presented, I think everyone agrees that it is a possible case to deal with the aligners, and with maybe 14 aligners. And of course, it is also possible to treat it with the fixed appliance with brackets. But look at the patient's smile She refused to have brackets. Her problem was not an aesthetic one, it was functional. So what we needed in this case was to close the inferior interdental spaces, close the anterior open bite, improve intercuspidation at the premolar level, and place the cuspid in a class 1. The patient wanted a removal device like aligners. So at the time, I spoke with the parents in this regard, but the budget presented for treatment with aligners for financial reasons was out of question. So I decided to suggest the Pre-Finisher with the condition that the patient wear it overnight or every day and 2 hours a day. The Pre-Finisher is only one device, but because it is made of silicone, it allows the transmission of the masticatory forces of the patient clamping on the device to the teeth, causing them to change position. It is a device with which at the time I already had a lot of experience, so I knew what kind of results I could expect, so I made this suggestion. Sorry. So the patient should wear it all night and 2 hours a day every day. But the patient spent a little time at home at that time because of the school and ended up wearing it only at night during 5 months. And see, after 5 months, when I saw her, she only wore the device at night. And sorry, this was the aspect of the result after 5 months using only at night. The situation is better, but far from what I knew the device could do. In the meantime, she went on vacation, and I emphasized the need to wear it also at least after the first 5 months, when she wore it at night and 2 hours a day. Look at the result. We closed the diastemas, closed the previous open bite. We achieve a very good intercuspidation and achieve a cuspid class 1. So there is this is the picture before Pre-Finisher, after Pre-Finisher, and this occurred without taking up share time or physical work, because you don't need to have the patient every month in your share and to do some work in the teeth, in the substitution of the wires. This was 1 year of active treatment using overnight 2 hours a day, and in advantage, the patient didn't wear braces, didn't need to wear an orthodontic appliance outside the home, can eat, brush their teeth, and socialize without the hassle of the fixed braces or aligner. And this is clear for simple cases of orthodontic corrections. So it is possible to make this type of correction as long as the device is well used. But there is a question. You need to speak with the patient. You need to communicate with your patient. You need to motivate your patient to use the device. And for this, it's very important to explain the goals of the Pre-Finisher, to explain the need of collaboration, because if the patient does not collaborate, nothing happens. Okay, you need to explain the advantages of use this kind of device. You can use some before and after pictures to do this. Everybody can see the difference between a poor intercuspidation or a very good intercuspidation. And when I show to my patients what we can achieve if they use this kind of device after removing the the fixed appliance when they want, for whatever reason, they want to remove the appliance before the case is completely finished, because they are going to marry it. A very good finishing. Okay. But for have good results, you must know how to choose the device that fits into your patient. Okay, so this is very, very important. I will tell you just how to do it, but if you want to use this device, you have to take care with that aspect. Okay, so we need to take a measure from distal of the upper left cuspid to distal of the upper right cuspid, and this is the measure that will tell TP orthodontic for them to send us the device, the correct device. We have this kind of ruler. TP will give you this kind of ruler, so you can do a easy measure with this ruler on your patient teeth. I always get the measure before take the braces, 1 month before. 1 month before 1 month before take off the braces, remove the braces, I will measure the teeth, and I will see if I have this number, this device on my stock. If not, I can phone to TP Orthodontics and they will send. So this is another. Sorry. In here you can see if the measure I get when I put the ruler in distal of the left cuspid, and I see the measure in distal of the right cuspid. If this measure is 52 and I didn't do any extractions, I will ask the 0.52. Okay, very easy. If the measure, and you can see this is the ruler, we have this triangle here, and this triangle is placed distal to one of the canines, and the anterior teeth are contorned until we reach the distal of the other cuspid. In this case, the measurement is 49 without extractions, so I will ask for a 0.49. We choose the Pre-Finisher, still with the brackets in place. And on the day the brackets are removed, we put on the Pre-Finisher to confirm that is the correct number. It's very important for you to do that. And you should have a number up. If you measure 48, 49, you should have the 50 and the 48, because the first time when you put the device on your patient's mouth, when you don't have lots of experience with that, sometimes it's not fitting very well, and you need to have a superior number or an inferior number. Okay, so it's very important to try it when the patient is in your chair after remove the brackets, just to see if all the teeth are fitting in these holes. Okay, and you send your patient home with some instructions. The instructions that I gave them is to wear the Pre-Finisher overnight and 2 hours during the day, doing some exercises, and the exercises are to clamp the device and stay there like 5 seconds. Then open the mouth and then clamp again. So the silicone will have the teeth to their positions. This is the protocol from TP Orthodontics. I confess I don't use this protocol like this. This protocol, it's a little bit confused for the patient, because in the first weeks they do in a way, in the other weeks they do in another way, and I only tell my patient to wear it at night and 2 hours a day, because I do this to achieve a better patient collaboration. We know that if we demand a lot of collaboration from the patient, they end up not doing it. And if we get a compromise between what is necessary and what they are willing to do, we are more likely to have good results. Mainly in Latin countries. I live and I work in Portugal. I don't know, Anglo-Saxons or Nordics are perhaps more compliant, but this is my experience. If I demand too much of the patients, they don't do anything. So I will present to you now. Well, she has a super fast 2 in the right side, deep bite, vestibular inclination of the superior central incisors, lower diastemas, a midline deviation. And we started the treatments with the protocol indicated for these cases. This was a very collaborating patient, so she used the intermaxillary elastics very well, but she had a problem. She had a problem with her hygiene. You can see she was always with some plaque in here, with some gingivitis, and when she was in that stage, I decided to take off the braces because of her hygiene. And you can see she was with the gingivitis in the lower incisors. But when we finished, this was the aspect, and we can see in the left side we don't have a very good intercuspidation. So I gave her the Pre-Finisher, the instructions, and after 1 month, when she came, the intercuspidation, it was very good. And you can see even this premolar that was a little bit out of the alignment, it's now completely perfect. Okay, so this is the before and the after Pre-Finisher. This was the initial photographs and the final ones, and the profile of the patient, and before and after smile. And now I will tell you, in my opinion, when can we use the Pre-Finisher? Okay, this is some suggestions for use, and you can use it when you end your cases with a perfect finish. You remove the orthodontic fixed appliance, and the finishing is so good. You can use it as a retainer. Okay, it doesn't require molds. You can give the device to the patient in the same day that you take off the brace, and you can use it as a retention device. In the second case, In cases when it is necessary to remove the brackets ahead of time, like I told you, when the patient wants to get married and don't want to be with the braces for the photographs, when patient is going to study or to work for a foreign country, and he needs to go without the braces. When we have some cases of poor oral hygiene, in that cases you can use it as a finishing device, because there are some details that you need to improve. So it allows to correct intercuspidation, alignment, rotations, inclinations, and even some crossbites. Okay, and the third cases has a correction device. In simple orthodontic treatment, we can use it as a correction device. Okay, so this was my presentation.
Thank you very much.
Yeah,
Do you have any
you're
questions?
welcome.
Or everything was clear?
Guys, questions? It's your question. The time to ask Sofia question.
You were familiar with the Pre-Finisher already, or it's the first time you'll see?
We had some experience with positioner, which is the same concept, but we do a setup for the patients to prepare it. So this one is more easy to use for us. You understand? We don't need the lab work.
I'm sorry, I think the connection is not very good.
Yeah, the connection is not perfect. So basically, we at my office, we had some experience with positioner, which is about the same concept, but you need the lab work. We do a setup for the patient, so you need to take a impression or scan, send it to the lab, and it's very difficult to find a good technician that knows how to do it, the positioner. So it was a problem. So you've been using this device for how long?
For 15 years.
Okay.
And so because I asked Maria from TP Orthodontics to be present, because sometimes I don't speak English every day, so sometimes I can't express very well. And if you have some problems understanding what I say,
no, it was very clear. Also, the presentation.
So
thank you very much.
You're welcome. So I used it for 15 years, and the first time that I really used it, that I have a real good result, it was with this case that I show you, the first one. Because before that, I didn't believe that it was possible, the device, to do so many things. So all this kind of movements. But when I had this desperate situation and I have not another option, because the patient didn't want the fixed appliance, I used the Pre-Finisher, and I really was astonished with the effect. It was incredible for me, because it was one device.
And then after that, you sometimes you switch to fixed retainer or to Essex retainer or something like that. You use this as the retainer.
Yes. No. I used to finish to do some to correct some details that we need, and then I put the removal. Maria, como é que se diz? O aparelho superior é a contenção, a placa de contenção superior.
Like a clear retainer?
A clear retainer. That one's with a vacuum machine?
Yes, okay. Yes, it's okay.
Yes, so after I use this for 6 months, or maybe 3, or maybe 2, because if there is just a little detail to correct, it's rapid. In 1 month it corrects those. I keep it for 3 months, and then I switch for a rigid retainer, like the vacuum machine retainer. And I always do fixed contention retainer in the inferior, in the lower teeth, with
together with the pre-finisher.
Yeah. Yes.
Together.
Yes.
כן, together.
Yes. Together. Yes.
יכול לשים.
I always-
מה?
I want to ask
Andrea,
also,
yes.
I don't know if you can hear me. In order to get to order one of these appliances, you have to measure, you said.
Yes.
But you also have to scan the patient and send the scanning, so you have to get.
No.
You
No,
just
you
get one size for one size for everyone who has the same length of arm.
Yes, exactly. And it's incredible. But if you have patients with, for instance, with a conic lateral, okay, a conic incisor, you can use that. Well, you can use if you do the restoration of the teeth, the tooth before you put the. Okay, to have both teeth with the same length. Okay.
Okay.
But yes, it's the same. It's only to measure, and it's incredible. It's very, very well done. The concept and the device. It's very well thinked and very well done, because everybody that has the same measure, it's the same device.
Okay.
But you have to measure it when there is no gaps between the teeth. Like after, like if I have a gap, for example, between the canal and the lateral.
Yes, you have to close the gap.
I close it with a fixed appliance, and only then I can use the pre-finisher.
Yes. Or if you have a tooth that is very narrow, you can close it with the composite. You can do a composite. A filler, yeah.
It's not.
And I never use it as a first choice to do a treatment. Okay, it's only in the very simple cases like the one that I showed to you, or in cases when I have to take off the braces ahead of the time, so before the treatments are really finished, or in cases, well, when I remove the appliance and the case is perfect, I use the pre-finisher. I use it for 1 month, 2 months, just because there are always little things to correct the intercuspidation, some little rotation, and in fact, when the patient comes after 1 month, I can see the differences, and I look at it, wow, it's better than when he left. So,
what is the most common size that you use?
50. The 0, 50, okay. 50, 52, 54, 50 here in Portugal, but I was talking with Maria about it, and she told me that it is very different in France or in other countries, because it depends of the structure of the bone structure and the size of the teeth.
So basically, when you put the lower, there is a question. When you put the lower fixed retainer, you bond the you debond, you put the lower fixed retainer, and then you give the pre-finisher.
Yeah. Yes. In most of the cases, yes. If I have a little rotation or a little space in the lower incisors, no, because I want to correct it. Okay, yeah. But if it's okay, I put, and it doesn't interfere with the pre-finisher.
So the movement is upper teeth, basically. You want to.
Can you hear me, Sofia?
Yes, perfectly.
Hi, thank you, Dr. Friedman, my name, and thank you. It was very interesting to see. If you have a patient that has a relapse, let's say, of an upper diastema that opened for about 0.5 millimeter or 1 millimeter, then you would measure distal canine to distal canine and reduce 1 millimeter.
Yes. Right. Exactly.
And what problems do you get with the Pre-Finisher? Are there any problems that you get,
I don't,
like emergencies or anything that you need to know?
No, not emergency. You have to be aware when you tried the Pre-Finisher on your patient before you left, okay? You must see that all the cuspids, all the teeth are well. Estão bem encaixados. Maria, como é que se diz encaixados? Pode abrir o seu som, tá? Sem som.
Where they bite correctly.
Okay, you have to see if they bite correctly in the device, in the marks of the teeth that you got, because if it's not the correct size and if it not fits correctly, you will have a problem. So it's the only thing that you must be aware when the patient put on the Pre-Finisher. It should be, every teeth should be correctly positioned, okay, in the device. But otherwise, no
issue impingement. If the hygiene is not good and the gums are swollen, then is it a problem to fit it?
Sometimes at the first, only if you had a very swollen gingiva, because what happens is when the patient is without the braces, he can he can improve the oral hygiene. So rapidly the tissues will begin to
shrink.
Yes, to shrink, and the contact of the Pre-Finisher with the gingiva, it doesn't hurt. Okay, it accommodates the gingiva. You know, it will do like a support to let the gingiva massage. Exactly, because it is a very comfortable device. The material is very comfortable.
And in terms of arch width, because the appliance is one size fits all, actually, not one size, but the arch width or arch shape, is there any problem with very narrow arches or very wide arches?
No, no. I in my experience, I perceive that I understand that the device is very well thinked and very well all the proportions, all the measurements. It's a great work of TP orthodontics, because when I used it, I never had any problem, and it always improved my cases. When I put
I've noticed you using Damon braces.
Yes.
So it's more adapted to the Damon arch shape, or you don't know?
Well, I can tell you, but because my experience really it's with Damon and with Pre-Finisher, but the arches, when you have a narrow archer, if you can put the teeth inside the holes of inside the appliance is a silicone device, so you will pass the forces of the patient when he clamping to the teeth, and you will open the arch. You know, you will do a very most wide arch.
And do you tell the patient for the 2 hours during the day, for 2 hours to clench?
No.
2 hours, full 2 hours to do the clenching exercise?
No. It's the exercise. It's they do 10 times a clenching of 5 seconds. Okay.
Okay.
Clench 5 seconds for 10 times. and they should do this 10 times during the 2 hours.
2 hours?
They should do 10 times, these 10 times, okay?
Okay,
You
100
understand?
times the total.
Yes. And I don't know if every patient does it. I really think that the majority of the patients really use it almost only at night. I do the instructions, but some ones really do it, but another ones they use it more at night, and the results are not a bad result.
And do you I forgot. Do you have a picture of how does it look when it fits well into the teeth and when it's not?
Yes, I have.
Well into the teeth? What is
I
good,
have.
what is bad fitting?
Yes, I have, and I thought I didn't have the opportunity to put it in the presentation, but I have. Yes, so if you want to wait a moment, I can have it. Just wait a moment that I will try to get this picture.
Anybody else has more questions?
יש עוד שאלה?
Actually, I want to ask also about relapse. Yeah, like do you have experience
Okay.
using
So I have it open here. Let me.
יכולה לעשות sharing?
I will share the.
You're the host now.
Okay.
You're the host now.
exceptions.
No
habits.
habits of the.
Okay. You can. No. Are you? Can you see the presentation?
Yes,
or
we
not?
can see. We can see.
Okay. So let me put in here. No, not this. Sorry. Okay.
This is not a good fitting.
Exactly. And you can see the difference. This is a good fitting. Okay. This is not. You can see in here we have some spaces, in here we have some spaces, in here, and it's an error that will accumulate until the back.
So here on the left side, you need a larger one.
Yes, you need a larger one because this is not sufficient to this is the cuspid and the teeth are not well adjusted. Yes.
Okay. Thank you very much.
Thank you very much.
You're welcome.
Sharing them. Thank you very much.
Okay. Thank you.
And your English is perfect. Don't wish that.
Thank you very much. It's not. There are some words that sometimes I can't remember, but okay.
We also don't speak English fluently.
It's normal.
That's fine. We can understand. Thank you very much. Thank you for everything.
Bye bye. Thank you.
Bye.
Bye.